Welcome back to episode 2 of This Too Is Healing. My name is Nettee. So we're going to carry on the conversation that we were having earlier. And I want to focus more on our brains and how our brains function, not only through menopause, but just generally, and how our brains, how under stress, our nervous systems and our brains react to stress and burnout, which are all words that we have heard on the internet lots and lots of times, and are kind of, some people say are overused or not, I'm unsure, but I'd like to talk about that a little bit more. So Adam, I'm going to pick your brain first because I know you have a lot of knowledge on this.
You might find it's a bit empty. You might find it's a bit empty.
No pressure whatsoever, because my brain is clearly empty this afternoon. And I think from my point of view, my brain is often just goes empty when I've got too much going on in it. So my brain, like just before we started recording, you said the word, you wanted to remember a word. Yeah. I won't steal that word from you.
I probably would have forgotten it by then anyway.
I'll let you say it in a minute. That I do a lot of what we're going to talk about in a minute. But how does the brain cope under chronic stress? So what does the brain do? Tell me, do you kind of know how that works with the brain? Because I know for a fact that I understand it physically, but I don't understand all the big words, but not that I want all the big words. Let's talk to me like I'm like a primary school child, really, basically.
I mean, it's such a big question. The brain is one of the it is the most complex organ, so I won't do it justice in this time.
Yeah, no, I don't. Yeah,
and there'll be neuroscientists going, "No, you missed that bit," and that's fine. But essentially, under chronic stress, the brain is designed to cope with stress in short bursts. Mm. So when you have stress hormones like cortisol and all, there's several other kinds, what they do is they prioritize certain neural pathways to get through problems quickly. But they also, by doing that, they attack other pathways. And I don't know why they do that, but they just do. So under chronic stress, it's actually starting to damage at a structural level, a neurological structural level. So chronic stress is just not sustainable, essentially, the body's not designed to deal with that. If you go back to even evolutionary times, you had your fight or flight responses, and if you didn't cope with that, you were probably eaten. So you didn't need to cope with it beyond that. So we live in a modern age now where we can be exposed to stress over long periods of time. And essentially that leads to things like atrophy, poor functioning, generally. So I don't know how to answer it more bluntly. And chronic stress is just generally bad.
And it is. And also, I think being in that chronic stress sort of overload and overwhelm, then that stops you from thinking sort of not correctly, but sort of in a calm manner. And I think we were talking earlier about menopause and how that affects lots of things, and brain fog is a big thing. Sort of how do you understand why that affects women in their menopause? What do you know what's happening with our bodies that's causing that brain fog?
Brain fog, yes, without a doubt. Yeah, it's just like, so we've got the 3 key reproductive hormones, sex hormones are estrogen, progesterone, and testosterone. Okay. Now, all 3 of them actually aren't just about looking after us during our reproductive years. They also, the estrogen, for example, has receptors in almost every single part of our body, especially in our brain. And so as these hormones are going down, or during the perimenopause state, going upside down, inside out, and back to front, and at any given time, there's becoming less and less. These estrogen receptors aren't receiving anything, and the brain is going, "What the what am I going to do?" So I love the idea, because the brain is then thinking, "Oh, I've got to set up new ways of." Emma being able to understand these messages that used to come from estrogen. This is the way I look upon it, because I'm not a scientist, just saying. But And so I've got to set up new pathways.
Right. Okay.
How am I going to do that? So whilst the brain's sorting that out, we ourselves are going into that brain fog, I feel, and not knowing what on earth's going on or forgetting words. And not just forgetting words, being distracted. That's what I find. I'll start doing one task, and in the meantime, that one task hasn't got finished, and I've started 5 or 6 other tasks and forgotten what the first task was. Or then I'm going to use that word, ruminate. I will spend hours ruminating either a conversation I had 5 minutes ago or what I'm going to be doing next. And that's all because, whereas before, I was a leader. I was in charge of 240 kids and leading a whole school.
This is where the wellbeing factor comes in. It's quite important because I'll give a shout out to an associate of mine, Andrew Curran, and he is a neuropediatrician. I think he's that. It's a fancy title. And he wrote a book called The Little Book of Big Stuff About the Brain. And what he detailed in that is how we learn. You focus a lot on relationships, but it's key here as well. It's about getting the optimal level of dopamine, essentially. Because dopamine is the neurotransmitter by which we seek things out. Serotonin's the transmitter by which when we feel satisfied by something. And so to get the optimal level is conducive for learning. Too much dopamine is stressful. Too little, you're almost comatose. So if you're going through something like the menopause, by focusing on the well-being side, managing your stress, you're able to then optimize your brain's chances of not reforming, but relearning some neural pathways or reinforcing useful pathways in the brain. Because your brain is essentially like a motorway. It's got several different pathways that it favors. And as you go through life, some pathways become less useful. And so new ones really are formed. And the older you get, the harder it is to form them. So by having less stress, but not so little stress that you're not doing anything, you optimize learning. And the best way to optimize learning is, 1, to feel good in the moment, but 2, to have good people around you. And this is, I don't want to segue into education just yet, but this is one of the things I talk about in education a lot, is the importance of having teachers you like is more important than their knowledge of a subject.
Oh, that's so important. Yeah.
Yeah. So if going back to your point about menopause and employment, by having people around you, not just your teammates, but your managers who may not fully understand what you're going through, but are sympathetic to it, your chances of relearning the job that you used to be so efficient at in a slightly different way are greater because your brain is changing, like you said.
Yeah, and it's exciting that it is. And how I'm just, every day I learn something new about the brain or our bodies and go, wow.
And I think, and like you're saying as well, and I'm just going to, because I know you're really interesting sort of in ADHD and autism, and you've done podcasts on that. And some of the things that you're saying about sort of brain flitting from one thing to another and forgetfulness and sort of ruminating, that is also very close symptoms that people with ADHD and autism have. And because obviously that's another big subject at the moment, not only menopause, but getting late diagnosis of ADHD and autism in particularly women. Do you think, and I'll just be the devil advocate, do you think that women, they've got to an age, they've got up to this age, and then they're showing all these menopausal signs of forgetfulness and ruminating and flitty brains, then they're going to get a diagnosis and ADHD, autism. Do you think that is sometimes misdiagnosed because it's menopausal, or do you think it's because it's undiagnosed ADHD, autism?
Yeah, obviously there could be a bit of both.
Yeah.
I do feel also, I feel that probably to a certain degree that they're underlying there throughout and always have been. But actually, watch the microphone. Actually,
I'm hitting it all the time.
lost my train of thought there.
Yeah, that's right. There it goes. There's that train of thought gone.
Yeah.
We'll be ruminating over that one in a minute.
You're right. But I think that the symptoms, some of the menopausal symptoms, if I call them menopausal symptoms, actually exacerbate them. And so whereas before they could have been underlying and you could have gone through life without necessarily ever being diagnosed, I think that menopause can affect women whereby then it becomes so much in your face that it can't be ignored. Yeah. And I wonder as well whether perhaps, dare I say, is there something of a bit people getting on the bandwagon? I don't know. I feel that
isn't it?
Yeah, because I feel I very much have got definite now traits that I never thought that I did have before.
And is that because that's your personality trait and how your brain is made up, or is that because you're going through menopause?
Yeah, totally.
I find that quite fascinating. What do you think about all of that? It's sort of because you've got a lot of knowledge when it comes to sort of that.
So obviously, being an education psychologist, we tend to focus more in the childhood years when it comes to things like ADHD. But we are working increasingly with people with late diagnoses because that 19 to 25 age bracket is becoming more, their needs are now becoming more paramount in society. Whereas before, once you reached 18, suddenly you had no needs.
Yeah. Suddenly you're an adult and you can manage and you can cope.
But I think every sector or every profession that's involved with diagnosing ADHD will accept that it's overdiagnosed. And part of that is cultural. Part of that has got to do with social media's, like you said, jumping on the bandwagon. Some of it is good in the sense that we are more open to understanding ADHD. We're more open to being sympathetic for those who struggle with attention. Some of it is not so good because some people use it as I can't cope with anything. My resilience is low because I have this label. That's not helpful. We should always be working on our resilience regardless of whatever label you have or whatever. We all have labels. We've all had experiences. I try to flip things on its head and talk about the experience of the individual. I think ADHD, it's very easy to say that you have it based off the criteria in the DSM, the Diagnostic and Statistical Manual. And what it talks about is things like struggling to pay attention, struggling to focus for a period of 6 months. That is very hard to observe as a clinician. So the chances of being diagnosed are greater. Now, I will say in this country, the NHS neurodevelopmental pathway, which is the formal way of getting assessed on it, is pretty good at saying no as a whole. Different parts of the country will have different experiences. But we also have private diagnoses, and I can't really speak to the validity of them. They will be up and down. But even that, the best system we have may only see 2 or 3 times over a 2-year period. So there's still flaws within that criteria or that process. But even though you've got the very conscientious pediatrician, very conscientious speech and language therapist, psychologist, so we are seeing that diagnoses are going up and some of them may be inappropriate. The big factor that we don't talk enough about, and there are psychologists increasingly on social media raising this topic, thankfully, is the overlap with trauma. And I don't mean trauma in the sense that just one-off event. It can be one-off event that affects how you process information and your ability to attend information. But it can also be what we call complex trauma, which is lots of overlapping experiences similar to that. So the biggest one that I can think of would be attachment. Having unhelpful relationships either with a parent, a carer, or sometimes even just a key adult in your life. And these things need to be considered when we're talking about ADHD, how someone is functioning in society. And in my view, they become more paramount than the label itself. Understanding that someone is going through something like menopause is more important than, oh, you've got ADHD. It's like, what is the day-to-day experience for you? How do you cope with these hormonal changes? Is it all the time? Is it sometimes? Whereas if I give you an ADHD label, it's like, well, she can't attend for more than 3 minutes at any given moment in time. That's not true.
But is it as well that, like, I think perhaps one of the reasons as well that women aren't being, the diagnoses are coming out so much later is because they do present differently when they're young, at teenage years, and so they don't have the normal signs that perhaps boys do. So there are far more boys, I think, who've been diagnosed with ADHD than girls, and so it's only perhaps that's got something to do with it.
It does, and one of the reasons we believe that is when you are newborn, male and female's brains are slightly different. They're still essentially sponges. They'll take everything in and structure their brains based on their experiences. But the female brain at birth is much more likely to have the verbal and the linguistic structures in place compared to the male brain. The male brain prioritizes visual information at that age, and then they play catch up with each other. What that means is young female babies are much more likely to take in language information. The more language that you're able to assimilate early in life, the more you can, looks like you're coping with. So you can use language to cover up your attention difficulties. Yeah. So someone says something to you and you say back 5 words and you're only 1 year old, she's fine.
Mm.
You know what I
mean?
Yeah, that's it. And also I think women are better because of that as well. Throughout the years of just masking, just managing and coping and pretending that they're behaving like everybody else. So you're watching and you're looking at everybody and how they're behaving and how they're reacting and how they're looking and
you
sounding.
Want to be the same, don't you?
And you just copy.
Yeah.
You're not actually, that's not coming from you. That's just you're copying another person. And I think women are very good at that, of showing that better than men, I think, or better than boys in general. Not that I am any expert in any of these subjects, but in lots of other ways because of trauma and because of diagnoses and stuff like that. So it's interesting. It's fascinating having you two on the podcast. It's so cool.
Well, I want to pick up on the trauma, if that's all right.
Yeah, pick up on the trauma because that's an interesting subject because that crossover of trauma and diagnosis of ADHD, autism and menopause, and when it all kind of I think it all kind of comes to like this peak when you are sort of that menopausal woman. You can't hold it in anymore. It just has to all come flooding out.
Or you just collapse in a heap and that's it, isn't it? Yeah. But so for, I was doing this neuroscience course and with Dr. Sarah McKay, I don't know if you've heard of her, in Australia. Anyway, what she has done is looked at brains or lots of research on it. And young people, you're talking childhood, if they have suffered from trauma, that affects how quickly their brain might grow. And I can't remember which way it is, but neglect, you've got different types of trauma and neglect, and you were talking about attachment. And depending on what that is will depend on whether your brain needs to grow more quickly and mature more quickly, or whether it recedes and doesn't mature because it puts let's put a break on this because what's going on isn't making us ready. Mm-hmm. Now, what then that will happen for the woman is when she hits puberty, that can help to put into her puberty is going to be, whether she's going to have sail through it or whether she's going to have difficult periods, painful periods. That's part of the everything that's going on. And then that also will affect what's going on with menopause. So even what happens in your childhood can affect how your menopause is because of the trauma and everything like that, which is mind-blowing,
And trauma is one of these words we have to always put a caveat on because some of life is just difficult and that's normal and you have to resolve it in your own terms. But what we're saying with trauma is when it's unusual and to the point where it isn't typical to cope. So it is normal to be upset with your parents, but it's not normal to be neglected by your parents. That's kind of where the difference comes. So just simply because of my own line of work, we hear trauma thrown around a lot, and sometimes it's inappropriate.
Yeah. But it's also, that is part of it though. So again, you've got this model of top down, outside in, bottom up, and the outside in is like your the social side of things, and that is life happenings, like you say, whether they're some things that we should manage or all of us go through, or whether it's serious, like you are saying, the trauma there. So you've got that coming at us one way, which can affect us. You've got the top down, which is our thoughts, our emotions, our feelings. And then the bottom up is our genes, our hormones, and the nutrients we put into our body.
That's quite a nice model.
Sleep. And all of those play on, this is why we all have unique experiences, because they all affect us. And I think that's whether you are female or male, but obviously with the sex hormones, with the female, I think it hits us in the face perhaps a bit more than it does men.
Yeah. Again, I'm not a hormone specialist, so I wouldn't be able to say about that. What I do know is particularly at the younger ages, but say between 0 and 5, the brain's top priority is safety. And when you have what I would call an insult to neurodevelopment, and that doesn't mean like just being hit. It can be the neglect we spoke about, or the flight or fight responses we develop as per attachments we have, or even just being exposed to a one-off traumatic event that you may physically remember, but not visually remember. You can't autobiographically recall it. And what the brain does as a result of that is it tries to protect itself. And if the brain is in that mode, we have 3 main structures to our brain. We have the brain stem, we have the limbic system, and we have the neocortex. The limbic system is actually kind of, in my view, the most important, because that's where all the emotions are held. And it needs to go through a flourishing state in those years, so that it can then engage the neocortex more, which is where your logical thinking and your problem solving and your attention span and all those things happen. And if the limbic system isn't in a good place, that connection breaks quite quickly. We use the phrase "flip your lid," and that's what we're kind of saying. That part with the brain, where those two meet, I think it's around the cingulate part, which sits kind of there for people, and put my thumb into my fist, and my thumb is touching my fingers. And as we're talking about that connection point, and when the brain feels that it's not safe, then that limbic system becomes too strong. And we often talk about the amygdala. That's your threat response. And for the mothers listening, you'll be interested to know your amygdala almost doubles in size after the birth of your first child.
Really?
Yeah, because the more aware you are of threat, even to the paranoid state, the safer your child is. Even if you get it wrong 6 times, that one time you get it right, it's worth it.
Yeah, it's worth it.
So therefore, and the sad news, it doesn't go back.
Oh, really?
Yeah.
Oh,
So we don't get our testosterone back, and you don't get your amygdala back.
well, I suppose that's fair.
And so these things are important to remember, especially in those younger years, because they become the blueprint of your predominant neural pathways. So if you experience trauma early in life, you're likely to be a bit anxious or a bit fearful later in life. And then you carry that through, and then you have to do some serious work. We talk a lot about reflective practice. We talk about therapy. We talk about talking therapies. These are great, but there's no substitute for having a really safe, secure environment early in life, sadly.
Yeah. Can I bring up about what you're talking about, the chronic stress at the beginning of the episode?
Yeah, absolutely.
Because when you were talking, it just made me think about the fact that actually the reason it can be quite serious is because when we're in that state in the sympathetic nervous system, we are breathing as though we've got that lion chasing after us. And so our breath is coming from our mouth and up here in the chest. And we're not breathing properly. And if we are now in the world that we live in now, we're almost constantly in that sympathetic state. Yeah. We're not breathing properly, which then affects our whole body. It's just like blown me away again. That simple things like breathing properly can help us in so many ways.
Thing, I feel.
Cardiovascular health. I can't remember the list of it. I didn't write it down, so I can't. But there are so many different reasons why we need to be focusing on our breathing. 85% of us don't breathe correctly.
And I totally can relate to that on all of those levels because, of course, as a lot of people know, and I'm more open about talking about it, I've come from trauma as a child, and my nervous system has been shot for whole of my adult life. And it's only recently I've started to learn that breathing's the most important thing, because I've noticed that because I spend most of my time not breathing, I can hold my breath for a very long time without actually taking a breath out. But it's interesting, I'm more calm in stressful situations.
I was just going to ask about your job. How do you, because you must be in a constant state of...
Yeah. So I'm calmest at work when I'm at work doing my job. When I'm not at work and not in that situation, that's when my brain will sort of ruminate a lot. But at work, when I'm dealing with a stressful situation, because I'm good at pinpointing and hyper-focusing, that's where I shine, because I can completely drop my breath and I take a breath out and I deal with the situation. But other normal situations, like I have put it on Instagram a few times now, I'm trying to be more open on how I just struggle even going to the supermarket. Going to a supermarket is really overwhelming. For lots of people, whether you've got diagnoses or not, it's overwhelming. It's an overstimulating situation. But you would think somebody that can deal with somebody that's dying in front of them can deal with that really well. But I can't go and get my shopping.
Wow.
And it's, but I can go and get it, but I have to build myself up to it. And it's interesting that whether that's to do with diagnoses or not, menopause or not, it's sort of, I've had to learn, and going back to the breath, I've had to learn to do what I do at work, but do that in my normal life. Sort of do that breathing and breath and dropping. And I want to talk about that more in the next series, talking about our breath and breathing and things that we can do to drop our body into that relaxed state, because I can do it well in that stressful situation, but it would be nice to be able to do it well when I go and get my shopping at Tesco's.
Totally.
The thing, sorry, but just before we leave the breath, there's because the breath is important. It links directly to the heart, which is linked to the sympathetic and parasympathetic nervous systems. The point I wanted to raise was the other key factor is having good relationships in your life, because the more you are able to relate to people on a vulnerable level, as in I am comfortable showing you my most vulnerable side, then the more relaxed you feel, which means that you don't start off in the sympathetic nervous system, that high anxious state. You're more likely to be in the parasympathetic bit, which is one, conducive to learning, but also conducive to just general well-being. And regardless of your trauma, etc., being able to have those vulnerable moments with people on a daily basis means that you have to focus less on breath. So I like to think of it as breath's really good to get into that state, but relationships keep you in that state.
Yeah, it's interesting you say that. And I think maybe at work, that's why I find it easier, because I am dealing with the patients and I'm building a relationship, a very quick relationship, but you build a relationship with the person that is your patient, and you're talking to them, reassuring them, keeping them calm. So I suppose that relationship, they're in a vulnerable state and I'm there to look after them. So maybe that's why I find it easier at work. I'm not sure, really.
Oh, it absolutely is. And I know this episode's all been about the brain, but we have what are called, my accent's going to mess this up, mirror neurons. We always want to say mirror. Mirror neurons.
Keep saying it again.
No, it'll be mean then. So by looking at someone, my neurons will be watching you and they'll be firing based on what you're saying and doing. And if you look calm, then I go, this situation must be a calm situation. Yes, exactly. Therefore, I must calm down.
Yes.
And that's what, thankfully, I haven't had too much to do with paramedics over my life. But when I have, they are very, very good at staying calm, and it helps big time.
And that's the key thing, isn't it? And even if we call it at work, you're being a swan, basically. You're calm on the top half.
I can see the feet going there.
Little feet are going like this in your brain, and you are you're panicking in your brain a little bit. but and I suppose that's a form of masking as well. That's probably why I find it quite easy, is that you are...
And you were a teacher before, so it's all about masking.
Yeah, that's right. What was I saying? Oh yeah, swan. So your little legs are going, but we give that persona, appearance.
But it does relax people, doesn't it? And it does, and that's what you need in in that situation.
Yeah, absolutely, absolutely. Because it's no good coming in a flap, because if already you've just escalated the whole situation, haven't you?
And you can see it as well. I think you can see if someone is actually putting it on, because you can see that underneath that you can feel, oh gosh, they're uneasy about something, and something isn't.
Yeah,
are your legs kicking now?
Yeah, all the time. Yeah. Yeah, absolutely. I think things like this, it's good. I like to push myself into these situations because A, it's not natural, and B, it's sort of it's I am holding my breath, because when you're talking about it, I was thinking, oh yeah, no, I'm holding my breath while I'm sat here actually. Yeah, and my whole body is in tension. But I suppose, but is that I feel sometimes that's my natural state.
And I think that's it, that most of us now feel our natural state of breathing is that actually it's that sympathetic breathing state, ready for the fight or flight. Yeah. But because we do it all the time so much, we think that that's natural and that's fine. And actually, we've got to almost go back a whole big way. We should be breathing through our nose.
And it's that slow breath out, which is the most important one, because that stimulates the...
parasympathetic.
Yeah, that's right. It's that breath out, because it's your vagus nerve that it's stimulating.
And we're only getting to know it now, and the Buddhists found out about 4,000 or 5,000 years ago.
Yeah, we're just catching up with it, really, to be honest, aren't we? All right, thank you so much. This has been really interesting. Thank you. But we'll take a little break, and then we'll move on.